A very good evening to all of you as we formally say hello. And we have been chatting along a little bit of people who have joined, and I'm very, very grateful. There are around 18 people in the room. If you are somebody who is not attending live, there is something which you are now watching recorded. So this is going to be around 30 minutes worth of content. And maybe there is a bit of Q&A 15, 20 minutes and see how we go. Just to introduce and say hello to all of you. My name is Manish. I am a dentist for last 30 years. I started my dental practice. The first one which I set up was 1997. So sort of a clinical experience from 1992 when I actually entered a dental school. So I'm proudly going to say it's more than 30 plus years within the dental fraternity, 34. And actually starting my practice and running my practice, probably this is my 29th year. So, what I'm sharing today, and I'm grateful to John that I can see some face. John is gone as well. So, Lucinda is here. So, hi. Hi, Lucinda. Hi, Sue. So, in effect, more people on video are helpful, but I'm now going to get on with this in a sense to say my experience share today comes out of the love in a sense of what happened to me in 2010, 2011, 16 years ago. So that is where I was 34, 35 years old. I've just celebrated my 50th birthday. It's my 51st year in on this universe. And my life changed in 2010, 2011 where Ash was doing his 8-day workshop, which some of you have attended, some of you are going to go, which obviously I've been shouting. My associates have done it, my friends and colleagues and people I know have been on Ash's program. So 2010, 2011, I was an NHS dentist. Uh, Sometimes I find it embarrassing to say, but I have to say I was an NHS dentist doing 11,000 UDAs. And ignorance was bliss because at that time, everybody was working through the system. I went into the NHS as an NHS dentist 2006 when the system of UDAs came in. And I still remember 16 years ago, I met Ash and Ash said to me, Manish, listen, you can't be doing this private dentistry if you are going to stay in the NHS. Just get out of NHS tomorrow and just do private dentistry. And I looked at Ash and I'm saying, Ash, uh, what are you talking about? I'm already a six-figure dentist. I'm earning 150,000 pounds a year, and I'm doing 11,000 UDAs. The company is proud of me. How can I just come out of NHS? And Ash said, it's up to you. I can just give you the knowledge. What you want to do with the knowledge is up to you. So he was quite blunt at that time. And I took it with a positive approach to say, okay, I really need to make a change because one of my nurses, who's now still with me for 20 years, she told me one evening when I had done 60 patients from 9 to 5:30. Can you imagine what kind of dentistry I would have done? 60 patients by the end of the day. But my adrenaline was pumping. My ego was there to say, look, how many UDAs I have done. I've done 60 patients. And I was like, and my nurse looked at me that evening and she was knackered as well, like me. And she said, you're going to die very soon if you do this kind of dentistry. You are going to be in trouble with this kind of dentistry. And I'm not very proud saying this today, but I did want to share that my journey started where 11,000 UDAs was a big ego boost for me. And I regret being in that situation now when I know what I know now, basically. So if anybody is sitting here who is doing NHS dentistry, my huge respect. I've done it for 7 years of my life, professional life. And I realized one thing is I can deliver basic dentistry. I can help people with need-based dentistry, and I have huge respect for the NHS in the UK because it does help people. But my understanding is the scope is limited, and the limited scope is because of the logistics. Yeah. No one in NHS dentistry says that you can't do comprehensive dentistry. But if I do comprehensive dentistry within that ecosystem, then there is a chance that I will probably be doing less than what my basic national minimum wage is, because I won't be able to complete that kind of comprehensive dentistry with the time span and the number of units of dental
Okay.
activity I would have
Right.
done. So just to come
What you
back
do
to the
when you get
point of what
past,
happened in
what did you do
2010,
to
2011,
cross up
um,
on the weekend?
sorry, there is
Stop.
some noise behind the scenes. If I may just ask people to make sure your mic is mute. So the point I'm coming to is Ash said to me, Manish, listen, you need to get out of this. And I made a positive promise to myself in 2011, late
Such
2011,
as we're going
2012,
outside.
where what exactly happened in 2011, 2012 is I spoke to my company and I said, can I shift 1 day private and can I do 4 days NHS? And they agreed. So I discipline myself 1 day a week to say, that's it, private dentistry only or comprehensive dentistry only, and 4 days of NHS. I started changing the balance. And year on year, 6 months, 6 months onwards, by 2014, I had changed the scale to 1 day NHS, 4 days private, and then I gave up. In the meantime, from 2010 to 2014, me and my wife Shilpa had built two practices. I was still working outside as an associate just to make the balance right. But by 2014, I was completely out of the NHS. And Ash plays a very, very important role in my learning of cosmetic dentistry. And you've seen the movement. I've been very close to Ash since we met. So in effect, today I am going to spend, okay, there is the man who comes in now, Ash Farmer. Let me see Ash here. Hi, Ash. Very good evening.
Hello, hi.
Hi. It will be, as we say in our regional, you will live 100 years, because I've just said Ash Farmer and then you come in basically.
Right.
So I was just narrating our story, Ash, when you told me in 2010, 2011 to say get out of the NHS tomorrow, and then
Yes.
my transition over the 4 or 5 years. So I was coming to a point to the team here today to say one thing will change your journey, professional journey. And there is a famous quote by Tony Robbins, and it says something like this: in the moments of decision, your destiny is shaped. And my destiny was shaped from 2011 to 2014 when I started dropping that 1 day at a time. And then I learned with my mentors, Ashley Latter, Chris Barrow, Laura Horton, Ash Farmer, Brendan McDonald, Mike Bentley. There are a lot of teachers I was getting my content matter from, knowledge from. But finally, end of the day, what happens is you will have a lot of knowledge. And I'm not going to say all of you are in the board, but there could be some people sitting in this room who have done world-class education with Ash, and they came back from that course and they still haven't done more than 4 or 6 veneers. And I was in that situation after I came back from Ash Parmar's course to say, I know what to do. I know how to do. But for 6 months, 8 months, probably close to an year, I was just struggling because nobody was accepting my treatment plans. I couldn't hardly do 6 unit cases. And I had done a very big case on Ash's course, and it was lovely. And that patient is still with me. It's 16 years. And it was a fabulous case. My confidence was sky high. So people who are sitting here who are doing the 2 day program with Ash, I'm immediately going to say it's a no-brainer to do the hands-on position. I know Ash doesn't have any spaces this year, but you have to do the hands-on because that changed the trajectory for me. Now I'm coming to the point where I'm saying what actually started changing? Why did patients started saying yes to my treatment plans? And over the last 16 years, with the knowledge I had, the experience I got, and what I did, I launched a program called as Trust to Treatment. Today is a 30-minute kind of understanding of what really do I mean by trust to treatment. And I'm going to give you a quick demonstration. Let me do that now, actually. This demonstration is coming now. Let me see if I can see this. Okay. I'm going to send something in the chat box, okay? I've just sent the link in the chat box. And the link is to a payment link. Okay. My course program is worth £497 for the day. I have actually done an offer out here, which is 197. And I'm going to throw it out to you guys to say, click on the link and pay the money. Come on my course. I'm going to wait 60 seconds because I can clearly see in 60 seconds if anybody clicks, takes out their commercial card or credit card and pays the money. Who's wanting to pay the money? 197. It's only £197. Ash has invited me. He wouldn't have invited me if I was not good. Pay the money. Lucinda is smiling. Pooja is smiling. Ash is smiling. 60 seconds. Who will pay?
Am I in the background? Why am I supposed to say?
Okay, so some people are driving, some people are listening. Of course, they can't pull their card out, but Lucinda is still looking at the camera. Pooja is still looking at the camera. I can't see their hands moving. I can't see them keying in numbers on my Stripe link. No, you haven't, yeah? So I'm just trying to put a point out here. You hardly know me, correct? You hardly know me. You don't even like me at this stage, yeah? Forget actually buying in and paying me the money, Lucinda, correct? You're not, you said, who is he? I don't even know him. Ash said, come along. So that's why I'm listening to this man with gray hair, with no hair probably. And he might teach me something, basically. Okay. So that's what's happening. And there are three words. Your patients first know you, then they like you, and then they trust you. As simple as that. The Facebook formula, know, like, and trust. Yeah. If in the next half an hour, 45 minutes, you started liking me, you hear my journey, you'll see the strategies, you understand things, and you think, I think it's a merit for me to give my time to this man Manish on the 18th of April. And I'm actually going to give him the money as well, which is £197. Maybe at 7 o'clock when we finish, somebody will actually key in the numbers and actually book the course. Okay, it's discounted by £300. Now, this journey between knowing me, liking me, and building the trust, because when a patient builds the trust, he gives you the most costliest thing which he has, which is his time, and then, of course, gives a financial commitment. So, when this journey happens from, which I call it trust to treatment, what it means is they have zero trust when they first see or know of you. And when they actually do treatment, it's the highest trust level they have. Initially, when my journey started, we used to do something called as in-man aligners. It was a device which we used to serve patients for orthodontics, £1,500. And I opened my mouth coming out of NHS dentistry to talk about in-man aligners. And £1,500 was like my heart used to beat fast to say I've proposed and the patient is going to refuse. Yeah. And somebody took an in-man aligner. From an in-man aligner, I said, oh, okay, it's working. Then I found something called as clear aligners. Invisalign was not affordable. So then I started offering clear aligners and it was £3,000. And I opened my mouth this big to say £3,000 and somebody said yes. I was like, wow, what's happening here? £3,000. Similarly, Ash's course had happened. A veneer that time was probably £500 or whatever. And I was talking about 4 veneers, 6 veneers. That was £3,000. Fast forward 16 years. If now I have to give a treatment plan of £50,000, I don't blink an eyelid. I will say £50,000. And the belief you will need to move from a 500 to 5,000 to 15,000 to 50,000 only comes when you actually do things. Okay. I'm going to give you some scenarios which most of you are driving and listening to it and just resonate. And if somebody can type in the chat box a yes after I tell you the scenario, let me see how many are like me, 2010, 2011. Patient used to have broken teeth, crooked teeth, dirty teeth, in a sense, respectable way. And my eyes used to go like, wow, this is it. I can now perform the veneers for this case. And I would tell everything about a test drive. I would tell them about how veneers are, what etc. is, and I'll do a nice 20-minute speech. And the patient's eyes would also go like, wow, Manish, this is so amazing. I really, really like it. And then they would say, let me think and come back to you. Have you had patients where you have done full explanation, everything you want to tell them, and they came back with this line, let me think and come back to you? If you are somebody who's heard this before, can you say yes? Lucinda, Kunal, thank you. Sheila, thank you. Ash, thank you. Sue, thank you. So there are 4 or 5 people who are not driving who said yes. Meenakshi, Pardeep, thank you. So what I'm trying to say here is there are various scenarios. And this is what happens. They will use these lines. Doc, you're amazing. I love it. Let me think and come back to you. Doc, this is lovely. How I wish I could have it. I can't afford it. This is amazing. Let me discuss with Michael when I go home, my husband, and let me come back to you. Oh my goodness me. I love this, but I don't know if I can go through this. You know what? I've been thinking of this for so long, but I saw this thing where, you shave this teeth down. I don't like it. I see these people coming from Turkey. It's horrible. So I don't want you to touch my teeth. I know I would look nicer or I would get my confidence back, but I don't like the drill. So there are various things which people say. There are various things where people actually uh, give you that hint to say, I want it, but I'm not going to have it. Yeah. So a lot of people have said yes to say, let me think and come back to you. Or it's too much money. I can't afford it. Or I don't think I can go through this. Let me speak to Michael or Suzanne at home and come back to you. There are a lot of things where people will go away. Now, I'm going to put a little question, and this is where you might be in a vulnerable situation, but this is where I believe in the tribe to say it now, and I can help you or Ash can help you. How many of you are sitting here and who have done less than 5 cases since you've been on Ash Parmar Veneer program? And just say me in the chat box if you have done less than 5 cases. If you have done more than 5 cases already of 10 veneers or 8 veneers, then obviously you're doing something which is different. Yeah. So I've got one person very candidly saying that 2 people. Yeah. Lucinda's course is in March. Great. But there are people sitting in this room, at least 5, who have said, I've not done more than 5 cases of veneers, and that's fine. Yeah. I need a buddy. I need a buddy at this stage. Lucinda, are you okay to just speak to me? Let me coach you a little bit here because that's probably going to be, uh, uh, unless there is background noise and you can't come off mute, you can come
No,
off mute.
I'm okay now. Yeah, I'm okay. I found it.
Fantastic. Thank you so much. And I promise I won't do any role plays. You don't need to do any acting.
That's okay.
I'm just going to ask questions. How long have you been in practice?
Since 2018.
Okay, 8 years. Have you had these patients where you have asked for cosmetic dentistry, whitening, composites, veneers, etc., and they have said, let me think and come back to you?
Oh, yes. Yeah.
Okay. What I teach on the day program, I'm going to do section 1 first. I'm going to give you one tip out of that. Yeah. try this on Monday. The word is speak, S-P-E-A-K. I teach in mnemonics, but I'm going to talk about the P within the 5 letters. We don't have time to do the whole mnemonic because one of the section which I do is how to speak. And that is an important section because if you can't speak, you can't serve. And when I use the word serve, I mean sell. Yeah. So you want to energize your patients. And there are 5 things to do, which come in this mnemonic called as speak. And I'm going to talk about the P. P is position. When you do your consultations, patient is in the dental chair and you give the patient a treatment plan. Which position are you in when you do that? Are you in the 11 o'clock position where you are talking to your patient where he or she is in a supine position, or you actually get the chair upright and go in front of the patient and speak in a 6 o'clock position? How do you actually communicate your plan to the patient?
So I sit the patient up and I move in front of the patient. So we're
6 o'clock position.
almost
Sort of
6,
face,
yeah.
sort of
Four,
face
4
to
or
face.
5, yeah.
Four or 5, because
Yeah.
the leg rest is there.
Yeah,
That is
that's
why
it.
you're either 4, 5 or 7, 8. Understood. When you speak to the patient, what is he actually looking at? A model, screen, iPad? How do you show them what you're going to do?
So iPad, paper, or just face to face?
Okay. One small tip and one small change. Do you have a screen, like a television screen in front of the chair by any chance? Where
I
you
do
sit?
in the new practice. Yeah, I do in my new
Good,
practice. Yeah.
good. So Ash teaches a concept of co-discovery. Do you use a scanner? Do you use a 3D
Yes.
scanner to show images? Fantastic.
Yes.
So only one change you make on Monday. Go into a 3 o'clock position or a 9 o'clock position. 9 o'clock position is difficult because the spittoon is there. 3 o'clock position is where you are literally shoulder to shoulder. Yeah. Whatever you want to show the patient, throw it on the screen and you talk to your patient in a 3 o'clock position, shoulder to shoulder, both of you watching the same screen. And it is now proven that's the most strongest position where patient energizes and accepts the treatment plan. Yeah. The other 4 letters is something which we will do together on the 18th of April. But that position, which is 3 o'clock position, which is a co-discovery position, where almost like you're sitting with a friend watching a cinema and it's all on the screen. And all you're doing is you're not talking to them, you're talking with them, or you're conversing with them straight onto the screen. And both of you are looking at exactly what you want to show them. It could be AI simulation, as John might have explained in his laboratory workflow. I'm going to show you a few today. It could be Invisalign ClinCheck. It could be a smile simulation. It could be how implants are done, animations, whatever is your gadgetry in front of you. 3 o'clock position, powerful position, and the chances of the patient saying yes just go up. Okay? That's tip number 1.
Amazing.
I'm going to show you something, if I may. I'm going to share the screen, Lucinda. You are the dentist. I'm going to give you tip number 2 in a minute. Can you see this?
Yes.
Yeah. Gary needs a tooth replacement here, Lucinda. Give me the options, please.
So denture.
Yeah. Partial denture, acrylic, chrome, Valplast, whatever. Yeah. What else?
Yeah. Potentially bridge, depending what the other one is, if that's natural.
So a cantilever conventional bridge or a Maryland sticky bridge, probably. Yeah. What else?
Implant.
Dental implant. Perfect. So all of us sitting here would say denture, implant, bridge as primary generic objectives or options. Is that correct, Lucinda? Yeah.
Yeah.
Now, Ash taught me, and all of you know the golden proportions. If you're going on March, Ash is going to talk about a 10 by 8.5. Yeah. a mesiodistal width of a central, beautiful central being 10 millimeters with a cervicoincisal length of 8.5. Ash agreed, 10 by 8.5, ideal parameters. Now that is in my head. And as a general dentist, I'm purely looking at this and I'm saying, yeah, implant, please, denture, please, or Maryland bridge, please, whatever. Yeah. Now, when I look at this, Lucinda, if you see from here to here, it is much more than 10 millimeters. Correct?
Yeah.
What I know now, it will be disservice on my part to actually do a single tooth in this case. I can easily do, the patient will easily accept, and the patient will live for his life if I do an implant here with probably 11.5, even a 12 millimeter fat central incisor. Yeah. But with the way I do consultation, a small glimpse of it, okay? I say to Gary, come along, Gary, let's sit down. And this is software which I'll teach on 18th of April to say, how do you actually present your case? So if Gary is sitting in front of me, I've done a scan, I will say, Gary, I need to get some planning sorted. Let's sit down and then let me show it to you. And then Gary says, yes, please, no problems. I say to Gary, listen, Gary, this is too big. Very happy to give you a single implant, but it's going to look big. Would you allow me to show you something where I can balance the smile here? Your canines are really good. I like them. Even these teeth are good. I'm not saying no, but this is something which is comprehensive planning. And would you allow me to show that? I take consent. That's the language I use. And Gary says, yes, please. And I say, okay. Gary, I'm going to open up another layer, okay, here, where I am actually going to remove the original layer. So with very minimal preparation, so this is a scan of a virtual preparation to say how much do I really need to prepare. Obviously, this is scientific base to say how much preparation I need to do. This software is going to tell me remove 0.2 millimeter here, 0.3 millimeter here. And then all I do is I follow Ashpermar Burkitt, as I famously call 16 years. I only use Ashpermar Burkitt. And I have my golden tip burr, which will do my finish lines. And I say that I'm now going to do a little design here for you, Gary, where I can show you that the final set of teeth probably is going to look like this. Yeah. So although I have done a test drive for 10 teeth, but I say to Gary, just focus on this 4 teeth, Gary, and allow me to explain you what is the actual sizing. So if you see, if I do couple of veneers here and one veneer here and then do my implant crown, your 2 teeth are going to look amazing. And actually the smile will perfectly blend. And if I can show it to you in a transparency level, you can really see how big is your tooth and what kind of tooth am I going to put in between. So you can see the lateral incisor, mesial edge, Lucinda, we have built a millimeter mesial, and we have helped shorten the central incisor to a beautiful 10 by 8.5. So in effect, by using digital dentistry, by using Ashpermar smile principles, you are actually looking at cases differently. I'm going to stop the share. I have a 8 bucket system, which is a treatment planning system. Yeah. And it's simply in letters A, B, C, D, E, F, G, H. Yeah. So what actually happens in this 8 bucket system is when a case comes in, I use the word comprehensive dentistry. And I say to my patients, listen, I can do single tooth dentistry, I can do firefighting dentistry, but I can do long-term comprehensive dentistry. What would you like me to do? That is a question to ask your patient. As soon as the patient says, no, I don't want anything short-term firefighting, comprehensive, please, I immediately convert them into planning, and planning is digitally shown. When they say yes to comprehensive dentistry, that is where I put my treatment plan into the buckets. And for example, ABCD stands for align, B stands for bleaching, bite corrections, and bonding. C stands for ceramics and composites, and D stands for dentures and dental implants. Okay, so if you look at the concept, Lucinda,
Yeah.
this case could have alignment, which means the patient goes into orthodontics, teeth are pulled correctly, the space is gone correctly. Option one was given to the patient to say, shall we do orthodontics and reduce the space to a central incisor correctly? Would you like? And Gary said, no, I'm 59 years old. I don't want orthodontics. I said, absolutely fine. B stands for bite. Your bite is absolutely fine, so we don't need to change anything. C stands for ceramics and composites. Ash gave me the biggest gift of my professional life, and that's called as mock-up. My tip to all of you is mock-up, 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 mock-up. I have done millions of pounds based on this skill, which Ash gave me, mock-ups. I literally take composites and I said, Gary, allow me to do something. And I built the 4 teeth such a way and took a picture from a far distance and showed him a before and after. And immediately he looks at it and he says, that makes sense. And I said, now allow me to do the scientific planning. And that's why he paid me money before he actually took the treatment plan, which is the consultation. So my second tip is treatment planning buckets, workflow A, B, C, D, E, F, G, H. And I'll explain in detail on 18th of April. But what you understand from that is I will not do compromised dentistry. From Monday, I will only do comprehensive dentistry. Some dentists will use words called as aggressive dentistry, too much dentistry. Yeah. And these are the people who haven't done comprehensive dentistry. They shy away because they fear of touching a tooth. And that fear is gone for me because I have failed and I have learned. I've failed and I've learned. And every time I do, I say to myself, what's the worst can happen? This tooth will go. I have the skills of implants. I'll give you an implant for free. Don't worry. Let me do this for you. And doing dentistry on back foot, as we say in cricket, the chances are you're going to hit the stumps very quickly. But if you're on front foot, you know what you're doing and you are trained, you will do comprehensive dentistry. So tip number 2 is comprehensive dentistry, not compromised dentistry. Yeah. Moving from how to speak, how to understand diagnosis, treatment planning, putting them into a sequence, because Gary's case was A, B for brightening, teeth whitening, and C for ceramics or composites. Yeah. And then D for denture or dental implants. So he needed A, B, C, and D. He opted out for A. He didn't need a B. He was very happy with this color as well. So we said, okay, let's do the C. But by the time the C is done, let me do the D, which is dental implant, to place the dental implant. So on the day one when he came, simply we did dental implant, guided. We had a template which created his 4 teeth smile to protect the implant, give him the tooth immediately. And then Lucinda, that day when he went home, he was like beaming because he had got his smile back. And he was already talking about us, giving us testimonials, because suddenly what he was living with for all his life with a fat central incisor changed that evening. Make sense? So tip number 2 is correct treatment planning buckets, correct workflow, and comprehensive dentistry. Now, I don't know, Lucinda, if you have, I'm just using you as my case buddy because everybody else is listening. Do you have pen and paper?
No, I
No,
have.
don't worry, don't worry, don't worry, don't
Just
worry.
type it.
You are going to actually do me a favor. I am going to say, I'm going to do this for 5 minutes. On the chat box, just start writing letters one after another for me so that I'm just coaching you and you're actually honing your skills on how to speak, what to communicate, and how to energize your patients. I'm going to give you 8 letters, if that's okay. And you just start putting them in chat box. Letter number 1 is B, B for Bravo. And everybody is watching the chat box now because I'm going to build a system for you. This is what you take home today. And that's probably one part of my content. And then I can do a 15-minute Q&A with you. First letter is B. Second letter is U. U for umbrella. Thank you. Next letter is S, S for sugar. Next letter is I for information. Next letter is N for new. Next letter is E for expense. Next letter is S for sugar. And next letter is S for sugar. What does this word read, Lucinda?
Business.
I'm teaching you business, okay? Now, I'm going to explain my 8-step system, and people who are doing pen paper notes, who are making digital notes, this is the crux. It's an 8-step system. I give my gratitude to my coach, Ashley Latter. He taught me that alongside Ash Farmer in 2011. I honed the same system. I built my own stuff. I did my clinical dentistry, understood this, and this is my version of it, more as a clinician of what happens. Okay, I'm going to give you all the words, and then I'm going to explain some parts of it as my tips for you today with the time we have. B is building rapport. Yeah. You don't need to write in the chat box, but just listen to this, Lucinda, as we go. B is building rapport. We have been together, Lucinda, for last 35 minutes. Yeah?
Yeah.
Do you think we have a little rapport by now?
Yeah, it's
Little bit.
building.
Yeah. You know me by now, a
Not
little
quite,
bit,
not yet. A little bit.
little bit. You may have sort of starting to like the style, or you might want to say bluntly to say, no, not really. I don't like it. But anyways, I'm probably trying to head towards that know and like structure with you at this stage. Okay. And this is also risky, guys. When you're in a live session, you just make statements and you expect a yes. And Lucinda smiles and we say, okay, it's going on well. That's fine. So I'm trying to build a rapport with Lucinda. I want Lucinda to come on the 18th of April. I want to take the 197 pounds from her by the end at 7 o'clock. And the reason I want that is I am going to change your life. Okay. My belief is I'm going to serve so well on that 18th that by the end of it, you'll think, amazing. I'm glad I came to Weybridge Dentsply headquarters on the 18th of April. That's it. When you build this rapport, you build this kind of connection with your patients. That's stage number 1. That's what I've just said. U stands for understanding needs. I'm just going to give you the words now. S stands for storytelling. I stands for item information, which is product information. N stands for new benefits, what the patient is going to get. E stands for evidence as well as emotional outcomes, which the patient is going to experience by getting treatment done with you. S stands for soft close. And the last is S stands for sell close. Okay. Every time I speak to my patients, I have this 8 steps. It starts with building rapport. It moves on to understanding the patient needs. It goes into a storytelling format, which I explain in quite in a detail. And there is a mnemonic called as HERO. It's a HERO storytelling format. There are 4 parts to it of how you tell stories. And these are real patient stories, case studies you talk about, you energize your patients, you give them the product information, then you tell them what the benefits are, and there is a special way to say that. And then you actually explain them what's the outcome. What are you actually going to buy into, and what is that human need? And then you ask them some very, very specific questions, which is called as soft close, where you're almost like testing in a nice way. You want to ask that girl out for a coffee because you really like her and you really want to get married to her, but you can't go and say, will you get married to me? She'll slap you. You're probably going to ask them to say, shall we go for a coffee? If the coffee is refused, you're not feeling that bad, but a marriage proposal refused is going to be problematic. So what's the cell close is asking the girl out for a coffee. And if she says yes, then you go for the final S, which is your cell close. Okay. So I'm going to dive into the word you. And this is probably one of the biggest part on 18th of April to say, which are the 10 questions to ask your patients, understanding their needs. And if you get a yes and a yes and a yes and a yes to all these 10 need-based questions, you've already sold the treatment. Okay. So I'm going to give you one tip into understanding needs. Again, I teach in mnemonics. There are 10 P's. So all the testimonials you see for the 200 dentists who have attended the program, they will all rave about the 10 P's. And the 10 P's, which is understanding needs, is the core of building trust to treatment. So listen, I'm going to give you tip number. There are two P's, which I'm going to explain out of the 10. The first P is called as problem. Yeah. And the only question you have to ask your patients from Monday morning is, and if you can repeat it after me, once I said it, I'm going to take some like live coaching here. And it's a very difficult line to ask. And that's why I want you to practice it. Are you ready?
Yeah.
And the difficult line is, how can I help you? Can you say that? It's very difficult to say. Can you say that?
How can I help you?
Fantastic. Okay. So I sarcastically said that, but most of the dentists don't ask this. They actually look into the mouth and start telling the treatment plan. That's the biggest mistake dentists make. And that's where the patient says, let me think and come back to you. And the reason is that understanding need first question of how can I help you is not asked. The patient has not even told you what the problem is, and you have started giving a treatment plan without diagnosing. And the core of diagnosing is understanding needs. Does that make sense, Lucinda?
Yeah.
Yeah. Your NHS checkups or your private checkups doesn't matter. The first question to ask is, how can I help you? If the patient says, I've just come here for a checkup, I don't have any problem. Then you open the mouth and you see a broken tooth, missing tooth, dirty teeth, lots of plaque and calculus, and your head goes like, oh, you don't have a problem? Yeah. My tip to all of you is, when the patient has said, I don't have a problem, I've just come in because I need my 6-monthly checkup, respect it. Please do not invest your time on exploring any further needs. Please do not invest your time in telling them any treatment options. You just do the scan, you throw it on the screen and say, Mrs. Smith, thank you so much for coming along. I just wanted to give you a little visual of what it is. As I asked you and you suggested you don't have any problems, this is what the mouth looks like. Do you think you have any problem? And they will look at it and say, no. Then say, I respect it. There is quite a bit to do. However, I respect it that even if I give you a treatment plan, it won't be of any use. Is it okay that we save some time? I might just get a cup of tea for you. Shall we sit down and have a cup of tea? Because this consultation is not really needed. So when you book your next checkup, I would suggest please book it when you have a problem. Inverted commas, quote, quote, please don't waste my time and yours. Biggest tip, take it away today. 10 patient consultations. If 9 say, I don't have a problem, don't invest your time. But one patient who says, yes, I have a problem, now starts the system. Next P, next P, next P. Yeah. Now, very honestly, I'm going to give you that toughest question. And that's my 5th P. But hear me out. I'll actually demonstrate it with you now. Yeah. Lucinda, if you just unmute. Lucinda, my one-to-one coaching on this kind of subject, the pricing is £20,000. Would you like to sign up?
Let me think about it.
Good. Fantastic. Perfect answer. Now I will change things. Lucinda, when people ask me for help on this subject, they usually invest between 200 pounds to 20,000 pounds. There are various ways I teach dentists and teams and I get results. Did you have a budget in mind?
£300.
Okay, fantastic. You have two options, Lucinda. One is I have recorded a complete 8-hour trust to treatment program, and you can watch it at leisure at home any number of times if you like online learning. And I will give to you as a thing for 197 pounds. That's option one. And I'm doing a trust to treatment program, which is slightly costlier than your budget. But that's where I do one-to-one and one-to-many kind of in the room coaching and training, but it's 497 pounds. Which one would you prefer, sitting at home or coming into the room with me?
I see the value in sort of speaking to you perhaps face to face.
Sure.
It's a little bit more than I was expecting or hoping for.
Sure.
Is there any way we can bring it down a little bit?
So when you say bring it down a little bit, can you explain me a bit more? What do you mean by that? Sorry, you're on mute.
So you said it was what, 497?
Sure.
It's,
Yeah.
it's a little bit more than I was hoping for. Sorry.
That's okay. Thank you for volunteering, but I'm loving this, and I know the audience is here, and I know I've gone beyond my 45 minutes here, but allow me to finish this with Lucinda. So Lucinda, you know, when you said it's a bit more than what you're expecting, is it because of cash flow issues at this point, which means you have a budget of 300 and the 197 is going to actually crunch the monthly budgets? Is that correct?
Yes, at the moment, I do set aside so much for courses and so forth. Yeah.
Sure. No problems. What I would like to do for you is pay me the 300 pounds. I allow you to give me the 197 pounds next month when you actually use my strategies, and that first sale which you make because of what I teach you, when you feel confident that Manish, it was amazing, I actually earned the money, here is your 197, I'll wait for the money. Would that help?
Absolutely. Yeah. That would make, yeah.
How would you like to pay? Cash, card, or bank transfer?
Bank transfer.
Fantastic. What I'll do, Lucinda, is I'm going to send you the bank details shortly, and I've put you on the course. I'll see you on the 18th of April. Thank you so much. Okay. So what I'm trying, thank you, Lucinda. I'm really grateful with all happening around, but thanks. I'm trying to demonstrate a point, guys, here. I have actually sold a trust to treatment ticket at this stage. It's not final yet. Obviously, she's put on the thing on spot, and Lucinda is responding, but Lucinda was not in any pressure to say I need to spend it. But the question I asked was, people who come on my dentists who come on my program spend between 200 pounds to 20,000 pounds. Do you have a budget in mind? Now, because our budget is 300 pounds, I made two offers, one which was below 300, and one which was slightly above 300. I gave her two choices. I didn't give her three choices. I gave her two choices, and she accepted one, and she accepted with what she wanted to do, but she had a cash flow issue, and I gave her a payment plan. Gary came with a budget, which you saw the case, Lucinda, with one single dental implant budget, which was 3,000 pounds, but he signed on 6,000 pounds and he went away because I did the 3 veneers. So what does it mean is I gave him a range to say, people like you who come with this kind of complexity spend between 3,000 to 7,000 pounds. Do you have a budget in mind? And take me, this is the biggest tip you can take today out of the 10 Ps, because what happens is you're giving a comfort cushion to the patient, and some will say, I can't even afford that 200 pounds, say, for example. Yeah, in my case, when I spoke to Lucinda, I can't afford 200 pounds. And then you really need to think, is this the right practice for this patient, or they need to find something else, and signpost them to say, I think you should go X, because all the options with us in private dentistry will be from here. But I respect if it's a cash flow issue, we can arrange payment plans. It's just a timing issue. Let's wait for 3 months and we can reconvene then. So there are various ways. So I usually give you around 15 objections which will come in, and then how to decode the objections, how to understand what the patient is actually thinking. Because when they say, let me think and come back to you, they're not actually saying, let me think and come back to you. They have an objection which sits in this 10 P's. Either they don't have a problem, or P for price, the money is the changing denominator. But from Monday, just do two things, Lucinda. How can I help you? Sorry, can you still hear me? Yeah.
Yeah.
How can I help you? And the second thing is, patients who come with this complexity will invest between X and Y. Do you have a budget in mind? And don't change a word in this line. Do not do anything. So if you allow me just for 30 seconds, practice this with me. If you can unmute.
Yep.
Just say this first line with me. Patients who come with this complexity invest between X and Y.
So patients who come with this complexity invest in X and Y.
Yeah. Did you have any budget in mind?
Did you have any budget in mind?
Did you have any budget in mind? Budget is the word which you'll emphasize. Yeah. Did you have any budget in mind? And two
Did you? Yeah.
answers will come. Answer one is, I have no clue, you tell me more, which opens up the game to you to say, absolutely fine. Let me start with option A to option B. However, I will tell you what's comprehensive, which is long term, which is medium term, which is short term. You select short term, medium term, long term. I give you everything, no problems. Yeah. So in effect, when the patient is cushioning down to say, this dentist is listening to me, she's understanding my needs, that is the game changer, because now the trust is building up. It's not like 20,000 pounds and Lucinda says, let me think and come back to you. Manish is trying to rip me off. I'm not paying his fees, basically. Yeah. So in effect, having a solution in your box, which is allowing the patient to actually get some treatment done, which is phase 1 or phase 2, I treat you phase treatment protocols. So in effect, on the day on 18th of April, what happens is how to speak, how to diagnose and plan digitally, how to actually present your case, how to understand the needs of the patients and the business mnemonic one by one. What are the key questions to ask? And I did one more S, which is a soft close, which I did the soft close in a sense of the 197 program or the 497. It's almost like I'm not saying, are you coming on my program or not? I've just said which one. I give you two options, and then immediately I said cash, card, or bank transfer. And you selected one. Yeah. Now I'm going to send you the numbers, and then you will pay or you won't pay. But anyways, that was just a demonstration. I'm going to conclude. We're coming to the top of the hour. I'm grateful all of you are here. Still 23 people are here, which means you enjoyed. I am going to say it is 8 o'clock. It is late. People who would like to leave the room, this is your chance. I'm going to be 60 seconds off screen, off mute, on mute. I won't be disappointed or dampened if you leave. I respect your time. But people who are serious about this topic, I am going to spend 15 minutes more answering your questions. And if anyone is interested to come on the 18th of April, we'll have a discussion. So the time is now. The content matter at the moment is done. So have a good evening. But if anybody is serious to ask me more questions and learn a bit more, 15 minutes more is what I'm going to do. Ash, if that's okay, if I can do that.
Yes.
Yes.
Manish, thank you so much. I just wanted to say a few words. Firstly, I'm very sorry I came late. I was in a practice meeting and I just I'm being very honest, I overlooked the time. So
No, that's fine.
I'm very pleased you phoned me at 3 minutes past 7. So that was a kick up the backside to get home and get on the computer. So, okay. There's two words I'd like to mention to everyone, and these words are everything matters. Everything matters. And right now, the world we're in, guys, is very fickle. Okay, there's an economic problem in the country. People are doing shopping around. People are going abroad for tourism dentistry. Dentists are undercutting each other. Practices, they're short-staffed. Locums, corporates run things their way. This whole array of things that are challenges with us, yeah? Manish is one of the most successful dentists I've coached or trained, so I'm very proud of his phenomenal achievement. He comes from a humble background, and today he runs 6 practices with multiple associates. Almost all of them have been on my courses one way or another. Not only that, he's been doing digital dentistry for over a decade now. So it's like phenomenal the amount of knowledge and training he has. And he's an international lecturer. He also teaches, he's got thousands of followers in India. I know that. So, and for me, it's very, what I enjoy is seeing success in the truest sense. He's very down to earth. We're good friends. But I'm also seeing tremendous progress that you made since you first came on my 8-day course. I just want to congratulate you on that. I'm
Thank you.
certainly looking forward to coming on the 18th of April because life is a learning curve, guys. Honestly, well, what I've realized now is no matter how good I am, and I'm pretty good with communication and case acceptance and everything, but even in the last 12 months, I've seen some patients not go ahead with treatment, Manish. So I'm thinking, what is that one missing ingredient? I said earlier on, everything matters, but what is it, that one thing that I'm missing in? And sometimes price is important. The way, the soft words, price is a very emotive topic. It's the way you talk about it and the style you do it in the effortless, nice way you do it. There's just so many verbal skills, and I'm very much interested in discovering more about your mnemonic style of teaching. And we just learn gems from each other. This is what life's about. It's all about a learning curve. I've learned from some of the best people in the world. You've been to other speakers and people who've taught you who I've not yet heard from. So for me, it's like almost mastermind level of
Yeah.
understanding and communicating with each other. So, he doesn't need his 197s. Trust me, he's doing big treatment plans, but this is his giving nature, like mine, in sharing knowledge and information so that we all become successful. It's down to us, you know. So I just want to thank you, and yeah, everyone stay. Let's just ask some more questions. I've got the first question for you, Manish.
Yes, please. Yeah.
In the group, there may be some dentists who are doing some more NHS type of work, and private practice is obviously more better and desirable. But there's a couple of challenges within the NHS system, whatever the UDAs are or whatever they're forced to do or not do. What are the 2 or 3 gems or bullet points, tips you can give right now to a young dentist in the audience right now of things that have helped you surpass the NHS and do more private work? In the simplest way, give me some gems for that type of candidate.
Somebody was sitting here doing 5 days of NHS dentistry, like I was, and when I opened the course today, I explained. Um, I'm directly going to give you the steps, basically. Change one day with your employer to say, allow me to just sit and come and do comprehensive private dentistry, take a consent, and then block that Friday entire. Nobody can book an NHS patient in there. That's it. Absolutely do full-on dentistry from Monday to Thursday, 10-minute checkups, 15-minute checkup, whatever you want to do. But in those 4 days, you'll find those people who would say, yes, Manish, I have a problem. Yeah, when you learn the system. And then say, why don't you come in and sit with me on that Friday? I have 7 slots for 7 consultations. There is no charge to you. Just come and let's have a chat for 1 hour. I'm going to give you 4 letters. If you write them down: team, time, technology, and training. Focus on these 4 words. That Friday is about team, time, technology, and training. All you're doing is using people like John and Ash and other labs. We also provide some digital planning for you. We don't do any production. But in effect, what you're really learning in that 7 episodes, which you will have on Fridays, is actually generating work for comprehensive dentistry. And my belief is if you start putting your time at your own cost to say, let me speak to you for an hour and do a proper comprehensive consultation. Ash teaches you EX. Is it EX4,
Oh,
Ash?
oh yeah.
EX4. EX4. So Ash manual document of several pages of EX4 is what you're actually doing over this 7. Alongside, you're using digital dentistry to scan photos, which I'll teach you on the day, and simulation. The biggest tip I'm going to give you now, go and download something called as Airbrush. It's a simulation app. It has made me millions of pounds so far. It costs you 37 pounds for the year. Test it today, buy a pro version, just get it, no doubt. Take a picture of the patient in that 60 minutes and just do airbrush and show them a simulation. Then take your case to a digital planning center who will do everything for you, just like I showed you, and then you present the case. One thing which I did and which I do after every course, and concluding what Ash was asking me to give that tip, the tip is investment of 10,000 pounds into Ash Parmar course or whatever it is now, but I will budget another 10,000 pounds of my budget for the next 3 months where I am actually going to pay some part of the lab bill for my patients. I'm not going to make a single penny. I'm going to do it at low cost or zero cost, but I'm going to do my first 5 veneer cases within 3 months. People who are coming on the March course, promise yourself April, May, and June, 5 cases I have to finish. And if I need to pay the lab bill, I will pay the lab bill. That's the best help I did myself. I actually, when I got stuck over 8 months, nobody was accepting plans. And I spoke to Ash and I said, can I use the word fuck it and let me do this basically? Because that was the expression to say, I'm not going to go anywhere if I'm going to wait for the patients to give me the money. I have no credibility in the market. I need to do it. So answering Ash's question is take the responsibility because Ash will give you the skills. But if you don't use it, it's all going to go waste. Within a year, you will rust and you'll think, what did Ash teach me? Because I never practiced it. So in effect, get on, do it, pay the lab bills, do the 5 cases, shift 1 day out of 5, and you will see the magic. Because that 1 day, consultations happen, you're going to need the second day to do the treatment. Suddenly, NHS dentistry becomes 3-2, and I promise you, within 2 years, you're out.
Okay.
Hope that
Great.
helps.
Yes. Another question, conceptually, sometimes people's mouths in such a mess, Manish, that if you want to do comprehensive dentistry in planning, then the actual quote becomes quite high,
Yeah.
right? For the more novice dentist, what's the secret? Yeah, I mean, you don't have to explain the whole thing because I'm sure there are many elements into the whole journey how someone goes for case acceptance.
Yeah.
But you know, you use the word £50,000 a bit earlier on, but that I'm assuming is edentulous and doing full mouth implant treatment. Fine. But there are some dentists that I've coached that are superb at actually getting big case acceptances. And most people go back to their world and just carry on with general dentistry.
Yeah.
But, you know, in these modern day times where economic problems are there, how do you get bigger case acceptances? What are the effort and the skills one has to put in to actually become like that? Because at the end of the day, if we all did more bigger cases, it'd be more fun. You got more emotional satisfaction. Patients are looking better and healthier. You know, what's the secret there?
This I teach, I called as staged treatment or phased treatment. So this is a tip for people who use SOE or Exact. Ash, do you use Exact or some other
Yeah.
software?
Yes. Yeah.
Exact. In the ABCD EFGH framework, there will be general dentistry, hygiene, alignment, bleaching, composites, etc. So what I do when a comprehensive case is being discussed, you know, when you click on SOE and a treatment comes on the plan and it says appointment 1 and then it comes appointment 2 and appointment 3. And I don't remember whom I learned it from. I got the tip from somebody which I developed. What I now do is I go and right click on that appointment 1 word and I can actually change the word and I can write down in caps lock urgent phase. Appointment 2, I write down as protective phase. And appointment 3, I write down as cosmetic phase. I do the entire planning and I just put the RCTs, extractions, the immediate decay removal and fillings in urgent phase. Then I go and find out a big silver filling with only one cusp left, and I say this will benefit with bonding as well as a full coverage porcelain, and I put it into a protective phase, and the patient gets a printout which says urgent phase, say 3,000 pounds, protective phase, another 6,000 pounds, and cosmetic phase, 12,000 pounds, say for example. So they can visually see what the three things are. And that is one of the things which works beautifully to say, actually, you're going to need like 29,000 pound treatment, but don't rush. You're not ready for it at all. The protective and cosmetic phase is not for you, but I'm putting it here because these are the things which await 2027, 2028. Shall we get on with the urgent phase? Do you need a payment plan? And they will say, yes, please. Now, in the protective phase, Ash, whatever is written down, it stays on the system. I just complete the urgent tick, 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 or my associates do it and it's done. And we don't change the plan. When the patient comes for the next follow-up, one of those big amalgams would have broken and say, I told you about the protective phase where it's sitting in the crown. That has now become an urgent phase. So I just move the item into urgent phase, print it out again, and I say, oh, by the way, there are three other teeth. Do you want to do it when they become urgent, or do you want me to do it now? And they immediately accept the next one. So staging the treatment between urgent, protective, and cosmetic is probably the tip, and that's where the
Okay.
game changes.
So can you see the valuable nugget you just got there, everyone? He's explaining in a way where patients understand. The key is to talk in a language that the patient really, really understands. They understand the word urgent. If you're now telling me I've got to spend £3,000 on something that's urgent, I'll do it. If I've got a leak in my roof and my roof is about to fall off, even if it costs me 5,000, I have to fix it because it's urgent. Yeah. So these are the sort of valuable insights that we all need to master and become very good at. Yeah, really good. So that's good. Right. Any other questions? Unmute yourself and ask the question. Lucinda, you're not allowed. You've talked a lot. Wonderful job you did. But yeah, just Pooja, you're pressing the button. So please
Pooja is wanting to ask something. Yeah.
ask a question. Yeah.
Yes, Pooja.
Hi, thank you. It was very interesting and informative session.
Thank you.
So I have a question. I have a case. I've done alignment for the patient and then whitening and composite bonding. So with the bonding, in my opinion, she needs bonding for at least 1 to 1 2, of course. But the patient's like, I can only spend for bonding, which is 220 pounds per two, for upper right one and left one. So to complete the smile makeover, I want to do bonding for the twos as well. So I've been thinking of few things in this case. I'm like, should I just offer her the free bonding for the twos, edge bondings, and ask her for a good review? Or should I just say you can pay whenever you want, or give her a lower price? But I don't know how to deal with this. So at end of it, I don't want to leave the case like just edge bond one and one and not complete the smile. So how would you
Fantastic.
deal with
Yeah,
this?
fantastic question. When the patient says, I'm just trying to understand the psychology here, and I might be wrong, but when the patient says, "No, I only have budget for these two teeth, just do these two teeth," there are two reasons. One, the patient believes that I just need two teeth. The dentist is trying to give me four teeth unnecessarily. So she's politely saying, I only have budget for that. That's psychology number one. Psychology number two is she really has that budget and she has a cash flow issue, and you need to offer payment plans and sort it out. Yeah, these two things come to me. The P for problem has already been accepted that I have a problem. My next question to you is, have you done a mock-up for the four teeth to show her how she's going to look like with four teeth? And then have you removed the laterals to show her how she is going to look like with two teeth?
No.
That is the change. So if I'm doing a case, I'm not even going to give a budget. I'm going to say, Ash taught me this. Let me just play with composites, and you have expired composite or regular composite. It doesn't cost you much. Spend 15 minutes, do the four, visualize, spend your time, take photographs, look at every angle. They need to know this is something serious Pooja is trying to check. and show them. And the beauty of these mock-ups are just lift the two laterals and take photographs again. Give a printout and just they look at it and say, the value build in the patient's eyes and mind has not happened, and that's why she's dictating the plan, and you are probably compromising because the patient can't afford it. But patient can't afford it is not the reason here. I always believe they will find the money if they find the value. So this patient, I would say, bring again, and you've done the consultation. You just do a 4 teeth mock-up, take pictures, understand, show her the 2 and 4 teeth, and go back to her to say, what do you think? And after that, if she says, I really am sorry, I love it, but I just have 2 teeth budget, then say, not a problem. We have 2 options. No, not 2 options. There's only one option. I'm going to do the 4 teeth if you consent me to touch your teeth. The money which you owe me, I will give you 6 months or a year, and only when you are comfortable financially or you are happy with everything, just pay me. I'm not going to chase you for the money, but I really want to do a good job. And I would humbly request that once it's done, if you like it, and if I can use your photographs, if I can use it in my case study portfolio, I would be delighted. And I'll send you a Google link where if you can write some kind words, it will energize my next patient. So in effect, asking for testimonial, taking photographs, suggesting to them, can I use in my case study? And I will allow you to pay later, but I'm not going to chase you. Do it when you're happy, when you have the cash flow, or offer them a payment plan. And if they're happy to pay in 6 months interest free, then you can close it as well. But do not do the case with just 2 veneers. If you believe it's going to look compromised, your signature is going to be on that smile. So don't do it.
Manish, a quick question. Of the people you've done that to, where you say, pay me whenever you can, in your experience, say if you had a 3,000 treatment plan and someone owed you 1,000, in what space of time have you seen or found that they do actually pay up and they keep their integrity?
Very rarely that happens, but it is my greedy nature because I can see a potential in the case for a before after. I'm going to actually, in my head, I'm saying I'm putting £1,000 in my education and my marketing. I'm not even bothered if the £1,000 is going to come back or not. I'm just floating it out to say I'm not degrading myself by reducing the price. You still owe me, but I'm not going to chase you. I just want to do the correct job. And in my head, I've told myself it's marketing money invested, education money invested, positioning money invested. If it comes back, happy days. If it doesn't come back, it's my investment. But my signature is there. And that patient is going to talk about me to another one who's going to get me another £3,000. So usually I won't worry about the money. But whenever I have done this with patients, they have paid. I have not had a single case which did not pay.
And so does that answer your question, Pooja?
Absolutely, yeah, thank you. Because I want to complete the smile, and it's going to be before and afters that, I want to have nice ones as well. So.
One thing, just to conclude, I've learned over this 16 years is, in your heart, if it's compromised, it is compromised. Do not do it. Yeah. Because if you do half-hearted, you will keep inviting people in your circle who will only come to you for this half-hearted compromised work. When you start doing the comprehensive work, only those kind of people will start coming to you because they love your work. They don't want to do 2 veneers. They want the correct option. And you build your positioning. I call it, you own the room, and it is your treatment plan. The patient cannot dictate the treatment plan because you know what's best for your patients. However, we don't do paternal dentistry. We do with consent, but the way to say it is what you learn, and train.
Before we move to Sheila, I'll just add one other extra story to give you an example. I've got this lovely, young, attractive Muslim lady who did composite bonding with us 10 years ago, but then we lost track of her. She went, didn't come back, perio case. And then suddenly, out of the blue, like 8-10 years later, she came in and emergency, Ash, my front tooth is coming out. Literally, can you imagine? So she came in, Manish, and the teeth were just like loose. I mean, this is advanced periodontal disease now. So my treatment plan for her was to extract the front 4 teeth, prep the canine to canine. So the canine to canine bridge really works well. Okay, so I normally get the digital planning date done, and then I knew that 2 other veneers would look better. On the fours, I just said we'll do it free of charge. So John, this is the case we're just doing right now. You know, we did the bridge, then the 2 extra veneers were done. So I reduced the fee for her. I did the 2 veneers free of charge for her. It's not that I'm doing charitable work all the time, guys, but this is the human connection. You know, if she's a lovely person, family person, comes from an area where I know where she lives is not that expensive, and she's found it hard to just about find 5,000-6,000, whatever. For me to prep 2 extra veneers, Pooja, took like 1 minute each. It's like no prep. I'm just bringing those 2 teeth out. John's going to charge me the 2 lab fees. Fine, we'll just do it, right? But the point is just the case is going to look complete now. And from the heart, she really appreciates that I bailed her out in a time of need. That front tooth fell out that night. I cut the root off and I stuck it back to the adjacent teeth, got her out of trouble. Can you imagine for like a 35-year-old woman or whatever, how he's going to be walking a gap on the front tooth? Do you understand? So you got to, like Manish said, do the right thing and where possible, help your patients, and then it'll be good. Right, Sheila, where is she?
Hi, sorry.
Fire
Hi. So I've had in the last 6 months probably about 3 cases where I've done the consultation. Consultation's been great, and then they're really excited. They've gone down, paid a deposit, booked in for their next appointment, and then like a couple of days after, they'd ring up and cancel the appointment, ask for the deposit back, and just like I don't know what's going wrong there. And then I've even tried to some of them I've rang and asked like, oh, was there a payment issue or is there anything that I can help you with? But yeah, it's just I don't know. I'm finding it difficult to understand what I'm doing wrong here, or is it better for TCO to ring them, or like what should I do?
So I'll give you a brief answer, then Manish can give his point of view. So I like integrity selling for the 21st century, which you all know is by Ron Willingham. There are 6 steps in the sales process. And I promise you, you need to master all the 6 steps. I mean, Manish probably has more steps involved, but fundamentally, you'll all be embraced in the whole story of this. But whenever someone says no to me or doesn't go ahead with the treatment, I love to have an intellectual debate with myself and think, okay, where did I actually mess up here? You know, did I not? Did you got to understand the disc profile system? You got to understand how good you are at co-discovery. Did you give the patient enough time? If it, did you put any pressure on them? Were you stressed that day because you were short-staffed? Sheila, it could be any number of things, right?
Yeah.
Because there's 2 things. There's a scale, if you build up the perceived value, price doesn't come into it. And I'm sure Manish will agree, right? So there's a lot of soft skills involved in building up perceived value. Building up, I'll put the book there in a minute, Sarah. But there's a lot of skills involved in building up the perceived value. And Roger Federer, who I admire as a tennis player, he's probably the finest tennis player we've seen. There was a lecture they gave to a university, and it was a 25-minute famous lecture. And in there, he explained the word effortless, right? Now, let's just say, Manish, you're a salesperson, right? He's probably effortless. And what that really means, what Roger Federer was explaining, is because remember when he was playing the Wimbledon final, playing gracefully, beautiful strokes, best player in the world, winning, smiling, beautiful Ralph Lauren jacket at the end, gold Rolex, picking up the cup, right? How did this all happen? What does he mean effortless? And what he went on to really explain that no one really understands how much effort goes into something to become that good, to become effortless.
Beautiful.
Today was my day off. I played golf. Yesterday was my one big case presentation, 23,000-pound case. I had to make that happen and make it work. It was a receptionist of another practice referred the patient to me, right? And that's it. I really understood the patient. I did a beautiful PowerPoint presentation with my treatment coordinator help, professional report. I understood his personality. I took my time. Yesterday, I had to go socially to London because we were going for dinner and a theatre play. But I wanted to finish at 5 and get to London by 6. But the guy came in at 5. It took me 5-10 minutes longer, but I did not rush it. I took my time and explained everything so well to him that he didn't. He just went ahead and said yes to the urgent bit. And once I can do first phase painlessly, Manish, they'll never go anywhere else for the rest of their life.
Absolutely.
Does
Well
that-
said. Well
now,
said. Well said.
what are the a few nuggets you can give Sheila about the questions?
Yeah,
now?
like Sheila, there are various layers here which I may not be able to immediately understand with just the brief you have given, but Jim Rohn comes to mind as well as Ash was speaking now. What Jim Rohn, who's a great sales trainer, said, good salespeople sell benefits. Excellent, amazing salespeople sell outcomes. And then he said something which was very profound to said, but the world-class salespeople sell feelings. There are 6 human needs, which I'll explain on the day on 18th April. People are not buying implants or makeovers and veneers. They are buying their human need, and there are 6 human needs, and they're actually telling you what their human need is. And a good salesperson who understands needs, who understands human psychology, who understands human needs. And I've done NLP and I've done lots of other programs where I've come to a point, and thank you, Ash, for saying it. But getting effortless is a huge journey to cover to become effortless. And there are a lot of efforts to actually become effortless. And then it shows in your body language, it shows on your face, it comes in your command, it comes in your speech. And I feel after 16 years, I'm reaching somewhere where 7 minutes, it is what it takes me with the workflow. That patient sits for 7 to 10 minutes and the conversion happens 20, 25, 30,000. And the belief which started building to say, okay, there is a system behind the scenes. And at the moment, answering Sheila's question is, there are a lot of parts in the system which have either not been asked, not been understood, and that is why there is something called as buyer's remorse. Somebody pays the money, goes home, and somebody else speaks to them, why are you doing this? They think of something else which are more priority in their life than their smile. And the famous line, life takes over, and then they make a call to say, I'm so sorry, can I have my refund, please? But there are a lot of layers behind the scene. So as you explore the system, as you hone the system, you'll realize, and nowadays, when I mess up, in a sense, like case didn't convert, I don't want to be cocky, but it's 99.99% my cases convert when they're in my room. Yeah. And that is because the hard work is done by the team. But that 0.01, when it doesn't convert, as soon as the patient is gone, and I immediately know where I went wrong. And the reason I know where I went wrong is because I skipped and shortcut my system. So if you do a root canal treatment or a veneer prep with a system, serving people or sales is a system. And that's 100% across the world now, that you really need to follow a system. Yeah.
Okay. It's 8:30. I want one
Yes.
final question, and then we're going to wrap it up. Who
Yes.
wants to ask the final question for the night? Pooja, you've asked one already, so I'm going to bypass you. Someone else put their hand up. Otherwise, I'm going to pick someone. Sarah. Sarah,
who-
I'm going to get you to ask the final question. Then only then I'm not going to tell you which book it is.
if
Unmute
Sarah
yourself.
has a question.
Hi, I'm really sorry because I was a little bit late to this.
That's
Because I've really enjoyed it.
Ask
Ooh,
any question in the world you want, Sarah. Even
any
what
question.
trouser leg Manish's his trousers are, I don't mind. You can ask whatever you want.
I think where I struggle is that, especially with the veneer cases, is that I'm trying to build a portfolio of veneers, not composite veneers, so I've got loads of those. And I think I struggle in my demographic in my area to get patients through the door that can actually afford sort of porcelain veneers at the cost of the labs that I want to use. So I took on board what you said, where maybe I do some not completely pro bono, but maybe, I don't know if I could find some of my patients, the long lasting patients of mine, that maybe I could it'd be how to present this to them, as in, look, you know, I want to build a portfolio, and you know, this would be a treatment that would really benefit you. So I suppose it would be how to pitch, and I don't, because I'm not a car salesman, but how to pitch to those patients. You know, at this level, it's out of your reach, but actually, if I do this, how can I make it at your reach? Because I've managed to get a recent veneer case, and it's going to be a great one, and I'm using a really expensive lab, which is outweighing what I'm actually going to make on a case, but I don't really care because it's going to be for my portfolio. So I suppose it's how can I approach a few of my own patients that have expressed maybe a want in them, but it's too expensive, or they don't want to upgrade from composite to porcelain.
Right. 2 points. The first thing is once you have knowledge and like you say, Manish is on today. Manish, to be honest, when I came in, right, I thought you were going to do a lovely presentation and we're going to see all the like visuals of some insight, but he has actually controlled his Zoom meeting without actually showing us anything. So that's quite interesting. Okay, so Sarah, it's all about having the confidence and the knowledge and the skill to actually handle all sorts of situations with all sorts of people in a very beautiful and effortless way. That comes with experience. And secondly, I don't want you to use very expensive labs, okay? That man, John, who just showed his video, here, this guy in the glasses, the lab is called Sophistic. He's in Abu Dhabi, so he's actually 5 hours ahead. He's probably 2 o'clock, 3 o'clock, or 1 o'clock. I don't know what time it is. The work is stunning. I mean, from my point of view, I've been using a UK lab for 25 years, and for the last year, I've been using Sophistic, and we're talking about world-class work, and the support and planning is like unparalleled. So I don't just change labs for the fun, right? I mean, for me, I'm a person. If something's working well for me, I'm not going to change. But I can honestly tell you, you will see a difference here now if you actually try and test them. Okay, that's all I'm going to say to you. Can you just qualify when you said very expensive, how much you're spending per unit with this expensive lab?
Well, I work at a couple of practices, and one is very, very high end.
How much? Give me a figure per unit.
Right, okay. So a single crown or a single veneer, for a central incisor, 695. I've paid.
Okay, John, can you unmute yourself?
Or lab bill 695.
So 650 for one. I nearly died.
The lab fee.
Lab bill for that one.
Lab fee.
That was the lab fee
Right.
for a
Sarah?
single crown.
Sarah, have you made John here? Sarah, have you made?
I use other labs, but I nearly died when I was like, oh my gosh. To be fair, the veneer work they do, the feldspathic, is absolutely beautiful. But
Sarah,
I've never paid that much in my life.
Can I pause you, darling? Right? There are some technicians I've worked with. Look, I've been exposed and trained by Larry Rosenthal. This guy called Jason Kim, best ceramist in the world 25 years ago when I was learning all this stuff. So I know these top caliber people, and obviously they deserve to charge that much because they are that good. Okay. If you want world class, you see, it's in the hands of the skill of the technician. He can make Emax can be look stunningly good, as if you wanted. And I know you want all these beautiful cases for your portfolio. You deserve that because that's what's going to sell more cases in the future. But seriously, darling, you can't spend £600 on one unit of work here. Okay, John, how much do you charge per unit for UK dentists?
Good evening, doctors. So we charge 160 for Emax veneer, and we charge 240 for a feldspathic veneer.
Okay, try it because, like I said to you, don't just take my word for it. Test it yourself. Okay, and yeah, I mean, I know what you're trying to do, but sometimes you want the best for your patients, but it's down to your clinical. Manish, would you not agree with me? It's your clinical skills. That's 90% of the stuff, and then the lab is also the other remaining part. It's not just the lab.
Yeah. And Sarah, I think the second part of your question was about how do you actually build that portfolio of cases to actually present to your patients, correct? Is that what you wanted to know as well? So, what we do is, and this is for every dentist in my business, we have 18 dentists working within our business. We do something called as Smile Ambassador program. So what it means is every dentist is allowed to pick one case a month, where obviously their fees are also reduced as a dentist. But I also put money in a sense, if the case is worth 10,000 pounds, yeah, and they've seen the case, the patient has gone through the interview process, which I teach, and they have qualified, but they don't have the budgets. This is what we say to them. We run a Smile Ambassador program, and let's say the patient name is Sarah. Sarah, you qualify for that. I have an availability in the month of May, which is 2 months from today. My March, April is gone. Would you like to take the seat? Because there is a 30% reduction in the fees. Usually, this would be my treatment plan, and this is what it will cost you. The in return Smile Ambassador contract form suggests that we will take all the media rights in a sense of pictures, videos, photos, any events happening within the business. You represent us and you are the Smile Ambassador coming onto the program, and we'll use your case study documented to go into email newsletters, social media, website. Would you like to take the spot? So when they hear that, this is automatic consent for your case portfolio. So all my dentists know that they can create 12 cases over the year where the cost is got down, and 30% is the maximum they can go to according to the business economics. So use the word. So I use the word very diligently. Smile Ambassador program. You will allow us media rights, and it's one case I'm allowed a month, and my next 2 months are full. Do you want to take the spot in May? So almost creating a positioning to say it's everybody's taking this, and you qualify. Do you want it? So that is another way to create your portfolio. Sarah, does that
A
help?
final tip for you, Sarah. There's a book called Change Your Smile by Ronald Goldstein. I don't know if you got it or seen it. Right. I've just gone on Amazon or Google. It's only like 19, 20 pounds, like this book here, like this cover here. Okay.
We have this in the practice for the last 15 years.
Yeah.
It's amazing.
It's really simple. For like 20 pounds, you're going to get a book with every type of case in there. Orthodontic surgery, gummy smile, gaps, crooked teeth, whatever. So until you build up your own portfolio, which is the best, which is down to good photography as well. Like right now, I've got hundreds of cases, women, men, young, old, gaps, this, where. So for me, it's always like, this is the patient's problem. I'll find the most suitable case and show them my exact case. And that's the most credible way. But until that point, a lovely place to start for the younger dentists, or even if you haven't got this book, just get this book, Change Your Smile by Ronald Goldstein. And you can get it from Amazon or, and I think that might be a good starting point. But just do co-discovery, do mock-ups, and just get on with sensibly priced labs and just do cases. Okay. All right.
I know we have gone 90 minutes. Ash, if you allow me to conclude,
yes, I will let you conclude.
With the final tip, is I'm just going to ask. There are still, other than me, Ash, and John, there are 15 people in the room. Who would like to come on my program on 18th of April? If you say yes in the chat box, I would be delighted. It's 197 for you. Who would like to come on the program on 18th with the value you have got, and I'll give you 10 times more value. Ash, Sheila, Lucinda, that's a big win. Kunal, thank you. Brilliant. That's my final tip. Pooja, fantastic. 5. Sue, 6. Mansi, 7. That's 1,400 pounds in my pocket. Well done. Thank you. Pradeep is hopefully. Yeah, that's good. Sarah says, I'd like the details, please, because you haven't seen the 90 minutes. Last tip. I asked for business. I asked the final question, would you marry me? Most of the people's date, and keep dwindling, don't ask the final question. I asked you the final question. I got 10 yeses. Now, 10 yeses on a chat box doesn't mean 10 people are going to pay the 197. Now, the next test happens now, where I put the link, I put the program link and everything into all the groups where you're sitting. And somebody who is really energized will actually action today. They will finish this, and I will see out of 10, probably 2 will 80-20 rule applies, 2 will pay tonight. The other 8 are exactly like that patient who will think through, tomorrow will come, life will take over, they will forget Manish Chitnis, they will forget their need for this topic, and they will not pay. So I will get 2 bookings today, I'll guarantee you that. But there is somebody who's sitting here to say, if I really want to change, I liked what I saw with Manish and he will change it for me in that 8 hours when he teaches, they will only pay tonight. And I'm not doing this to push sales or anything. I'm telling you human psychology, and this is exactly what happens with patients. Life will take over tomorrow. There is no tomorrow. I'll think tomorrow. The hopefully is a lead for me because this person has to still build more amount of trust, or his problem is not that high and he doesn't really feel that as a challenge. So Pardeep might take some more time, but some of you who have said yes, after this, you'll see the link and your eyes on the screen, you have your card, you'll do it or you won't do it, basically. So ask for business, and that's when patients say yes. And that's the last step of the S, which in the business. If you don't ask for it, they don't say yes. Okay?
Good.
Thank you very, very much for coming tonight. Two requests. One is, of course, I'll send the messages to join the 18th April. But second is, if you speak to your chat GPT, if you use chat GPT, express yourself to say, what did I actually learn on Manish's 90 minutes along with Ash? And tell them, ChatGPT will write a beautiful testimonial. And I would be delighted even if I see one testimonial on the WhatsApp group to say, what did I like today? And that would be my fees and my energy if you can give it back to me tonight. I would love you. If you don't come on the program, no problems. But that beautiful testimonial for today, if you really liked it, I would love you for that. Thank you very much. Have a good night, Ash. Once again, thank you very, very much for inviting. And I'm going to see you on the 18th April, but I'll see you on the 20th and 21st March. I love to refresh myself.
All right, love it.
Thank you.
So thank you so much, guys, for tuning in. I really appreciate it. The WhatsApp group is there. Keep it energized, ask questions, cases, share cases. We're all there to support each other. Yeah, I mean, we're all here to help and grow and learn from each other. Amazing. Let's go and have some dinner. Thank you. Good night.
Have a good night. Thank you, Ash. Thank you, everyone. Cheers. Thanks, John.